Hi, I'm Chris Cebollero, and thanks for joining us again. You know, there's an old expression that goes, the job isn't finished until the paperwork is done. Well, this is really important when it comes to EMS as well. Our patient care record is something that's very important to ensure that we keep a historical document of how we've taken care of that patient. So one of the things I want to talk to you about today is how do we ensure that we give a good patient care record and put into the accounts of everything that we do? Well, one of the things that we need to realize first is that this is a legal document. And we've all been told that throughout our careers. And these documents will go to court. And you always have to kind of look at it that way. Hopefully, we never have to go to court in our careers. But if we do, are we able to defend what we've done as far as treating that patient when it comes to our charting? So we may not have to go to court, but if we do, we need to ensure that that historical record is going to give us enough reminder to talk about what we did on scene that day. It may be 2 or 3 years after the fact, so you need to ensure that the record that you put together is something that you're going to be able to utilize when you have to stand in front of those lawyers. Now, one of the things I want to mention is it's important that you're very accurate in your patient care record. Everything that you do needs to be in there. Everything the patient talks about when it comes to their signs and symptoms, you want to be able to add. Your comments section is a very important component to your patient care record. And one of the things that you want to look at is to put things in your comments section that you've seen or that the patient has said to you, but kind of keep things out of there that don't deal with patient care. Sometimes we get in the habit of adding things that shouldn't be in the narrative part of our patient care record. So how do we write a good record? Well, one of the things that you should think about is developing a step-by-step process similar to that you would with any other skill. It seems that we do our skills in a step-by-step process. Well, our charting should be no different. When it comes to electronic charting, one of the things that we see is that a lot of times there's stop signs that keep us from finalizing that report. I mean, that's a great help to us for anything that we've missed. But one of the downfalls to electronic charting is the fact of timestamps. We start an IV, boom. We do an intubation, boom. And it stamps the time that we do that. But there are others that as we add those skills, it'll add the time that we're actually putting the skill in the patient care record. One of the things that we have to think about is to go back and actually change the time to when we actually did that skill. And that's one of the things that may not be accurate in your patient care records. And some of the things that I see as I CQI those charts in my very own system as well. Your patient care record needs to be accurate. So if you did 2 sets of vital signs, make sure you document 2 sets of vital signs. But sometimes we get in the habit of putting things in our chart that we really didn't do. We did 1 set of vital signs, but we add that we did 2 sets of vital signs. We have to be very careful here because this is falsification of a record. And if this ever went to court and we found out that we didn't do that extra skill, now all the charts that we've ever done are going to come into question, and it's going to make our systems look very, very bad. You know, when we talk about our patient care record, it truly is a historical document. Remember, develop a process that you can go through step by step, that you do the same chart all the time. Document everything you do, and don't put things that don't reflect patient care into the comments section. I'm Chris Cebollero, and thank you for joining us.